Dental cavity treatment, a step-by-step 3D animation. You see that tiny, dark spot on your tooth? It's not just a spot. It's the tip of a terrifying iceberg. Because beneath that innocent-looking blemish, a microscopic war has broken out. It's a battle that can trigger an explosion of decay, hollowing out your tooth from the inside without you even realizing it. By the time you feel that first twinge of pain, the damage is already done. We're about to take a journey deep inside an infected tooth to witness what happens when the bacteria win. Every single day, your mouth plays host to a complex and bustling ecosystem of bacteria, fungi, and viruses known as the oral microbiome. Most of the time, everything is in balance. But when that balance gets thrown off, a destructive chain reaction kicks off, and we call the result a cavity. This isn't just a simple story about eating too much sugar. This is a story of acid warfare, of structural collapse, and of the incredible high-tech intervention that can pull a tooth back from the very brink of being lost forever. We're going to peel back the layers of enamel and dentin to give you a front-row seat to the entire clinical process. You'll witness the initial bacterial assault, the silent creep of decay, the precision removal of infected tissue, and the final artistic restoration that makes a tooth whole again. What you're about to see is the hyper-realistic journey of a dental cavity, from a single microscopic invader to a full-scale dental restoration. The invisible invasion, how it all begins. The story of a cavity doesn't start with a hole. It starts with an invisible community of bacteria building a city on your teeth called dental plaque. And this city builds fast. Within minutes of eating carbs, sugars, starches, you name it, certain bacteria, chiefly a troublemaker called Streptococcus mutans, throw a party. They feast on the sugars, and, as a thank you, they produce powerful acids, like lactic acid. Think of your tooth enamel, the hardest substance in your body, as a fortress made of crystals. Normally, your saliva is the fortress guard, keeping the pH neutral and rebuilding the walls through a process called remineralization. But when you give those bacteria a steady supply of sugar, they unleash a relentless barrage of acid. The pH at the tooth's surface plummets, and once it drops below a critical point of about 5.5, the fortress begins to crumble. This is called demineralization. The acid dissolves the mineral crystals that make up your enamel, pulling out calcium and phosphate. At first, the damage is invisible, creating tiny pores under what looks like a perfectly fine surface. This early stage, which might only show up as a faint white spot, is a crucial window of opportunity. The damage is still reversible if the acid attacks stop. But if that plaque isn't removed and the sugar-acid parties continue, the invasion is on, and the damage is about to get a whole lot worse. The iceberg effect, what you don't see. What makes a cavity so sneaky is the iceberg effect. That small spot you might see is just the entrance. Enamel is incredibly tough, but right underneath it is the dentin, a much softer, more porous layer that's riddled with microscopic tunnels leading straight to the tooth's nerve or pulp. Once decay breaks through the enamel fortress, it doesn't just dig down, it spreads out like a hidden network of tunnels. This is where the real damage hides. The decay balloons outward and downward, carving out a huge cavern inside the tooth, all concealed by a thin and now fragile shell of enamel. This is why a dentist can poke a tiny spot and find a huge area of soft, mushy decay underneath. The decay can advance without any pain at all, especially in hard-to-see spots like between your teeth, known as interproximal decay, or in the deep grooves on your chewing surfaces. As the bacteria march deeper, they get closer to the pulp chamber, which is the living heart of the tooth, full of nerves and blood vessels. If the bacteria reach the pulp, they trigger a massive inflammatory response called pulpitis. This is when the throbbing, agonizing pain of a toothache usually kicks in. If it's still not treated, the pulp can get infected and form an abscess. At that point, a simple filling won't cut it anymore. The tooth now needs a root canal or, worst-case scenario, to be pulled completely. This silent internal destruction is exactly why dentists use tools like digital X-rays to see the true size of the iceberg long before it leads to a catastrophic collapse. The intervention, removing the decay. When you're in the dentist chair, the first order of business is making sure you're comfortable. Local anesthesia numbs the tooth and everything around it, so the procedure is completely pain-free. With the area numb, the fight begins. The main tool is usually the high-speed dental drill. That whining sound is notorious, but its job is all about precision. Spinning at hundreds of thousands of RPMs, it uses a tiny burr to carefully remove the decayed parts of the tooth, all while spraying a jet of water to keep things cool and clear away debris. Your dentist can actually feel the difference between the decay, which is soft and leathery, and healthy tooth structure, which is hard. But drills aren't the only game in town anymore. Many dentists now use advanced laser systems like water lays. This tech uses a combination of laser energy and a fine spray of water to gently remove decay. The big win? Lasers often get rid of the heat, vibration, and pressure that make people anxious, sometimes allowing for fillings with little to no anesthesia. Plus, the laser sterilizes as it goes, which is a nice little bonus. No matter the tool, the goal is the same. Get out every last bit of infected and weak tissue, leaving a clean, solid foundation for what comes next. The restoration, rebuilding the tooth. With all the decay gone, the tooth is clean but hollowed out. Now it's time for the restoration, a multi-step process to rebuild the tooth using a modern, tooth-colored material called composite resin. This stuff isn't just strong, it's designed to look so natural that the final filling is virtually invisible. First up, etching. A mild acid gel is carefully applied to the clean surfaces. It sounds weird to use acid, but this step microscopically roughens the surface, creating millions of tiny pores. This gives the filling something to grab onto, creating an incredibly strong mechanical bond. After the etch is rinsed off, a liquid bonding agent is brushed on. It flows into all those microscopic pores and is then hardened with a special blue curing light. This layer acts like a super-powered glue, locking into the tooth and getting it ready for the filling material itself. And here's where the artistry comes in. The putty-like composite resin isn't just plopped in all at once, it's painstakingly applied in thin layers. The dentist sculpts each layer, slowly rebuilding the tooth's natural shape. After each layer is placed, that blue curing light hardens or polymerizes the resin in just a few seconds. This layering technique is key because it minimizes shrinkage, creates a super strong final result, and lets the dentist blend different shades to perfectly match your tooth's color and translucency. Once the last layer is cured, it's all about the final shaping and polishing. Using fine finishing burrs and polishing discs, the dentist perfectly contours the filling to match the tooth's original anatomy and make sure your bite feels normal. The surface is polished to a high gloss, making it smooth, stain-resistant, and feel just like your other teeth. In some cases, this whole process can even be done digitally with CAD/CAM technology like CEREC, where a 3D scan is taken and a custom ceramic restoration is milled right in the office. This allows for a complete, super strong ceramic filling in just one visit. This journey from a microscopic acid attack to a beautiful, high-tech restoration uncovers a hidden world inside our mouths. If you think this stuff is as cool as we do and want to see more breakdowns of medical science, hit that subscribe button and ring the notification bell. Every click helps us bring you more in-depth content just like this. The defense. Biohacking your mouth. Getting a filling isn't the finish line, it's a fresh start. The same forces that caused the cavity are still lurking, and preventing the next one means playing some smart defense. This is where you can biohack your mouth to favor health over disease. The name of the game is tipping the scales back toward remineralization. Fluoride is a total game changer here. When it's in your saliva from toothpaste or dental treatments, it integrates into your enamel, forming a new crystal structure called fluoroapatite. This new material is way more resistant to acid attacks. Another exciting player is hydroxyapatite, a mineral that makes up your natural enamel and can be found in some newer toothpastes. It helps plug the tiny tunnels in your teeth, which can reduce sensitivity and help rebuild tooth structure. But ultimately, the best defense is managing your oral microbiome. The goal isn't to have a sterile mouth, but a balanced one. You want to keep the acid-loving bacteria from taking over. This all comes down to daily habits. Brushing and flossing physically break up and remove that plaque city, while some mouth rinses can help lower the overall bacterial count. And don't forget your diet. Cutting back on how often you eat sugar is huge. It starves the bad bacteria, stopping them from producing the acids that start this whole mess. Think of it less like a war and more like managing an ecosystem. By controlling the food supply and keeping the population in check, you can create an environment where a cavity never even gets the chance to start. What begins as an invisible film of bacteria can, if you let it, lead to the catastrophic failure of one of the hardest structures in your body. We've journeyed deep inside a tooth to watch it all unfold. The relentless acid attack from bacteria, the silent iceberg of decay hollowing things out from the inside, the high-tech removal of the infection, and the artistic, layered reconstruction that makes a tooth whole again. A cavity isn't just a hole, it's a living, breathing process of destruction and repair. That filling in your tooth is a monument to a battle won, a testament to the incredible blend of science, technology, and skill in modern dentistry. It's also a powerful reminder that the best strategy is always prevention. By understanding the intricate world inside our own mouths, we gain the power to keep it in balance, ensuring our teeth stay strong for a lifetime. The future of dentistry isn't just about finding better ways to drill and fill, it's about giving you the knowledge to make sure you never have to.